people can even without a microphone. Okay. So now, now that our brains are all awake because we had to do lunch math, I'm going to bring us to another STEM subject, which is biology and biomedical research, and talk to you about the California Institute for Regenerative Medicine. And I asked, what table number is that?
2.
Table 2. I asked table 2 earlier if any of them were familiar with CIRM, and one was Mark, who's not here right now. Where'd that guy go? He was familiar with CIRM by way of the Buck Institute in Novato, which you may be aware of because they are one of the grant recipients of CIRM. And now what I'll do is tell you what that means. So CIRM is a California state agency, and it is now based in South San Francisco. That's where the office was. When I worked there in the early years, we were in San Francisco. And the mission, as you can see on the screen, I'll read it for those in the back. I know that print is a little bit small. Accelerating world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world. So how did we come to have a state agency in California focused on a specific area of biomedical research, stem cells? Well, in 2004, at that time, there was an executive order in place that prohibited most funding out of our National Institutes of Health for embryonic stem cell research. And because of that, and because we have so many world-class institutions here in California, including Berkeley, where Chris went, Stanford, where I went to graduate school, we have so many of them across the state, and we have such a robust economy in California, there was a group of people that felt a responsibility to not have an area of science that had so much promise for finding out more information about and potentially developing treatments and, knock on wood, eventually cures for some of the chronic illnesses that have plagued us for generations. They didn't want that to be shut down, so they got together and got a ballot initiative on the ballot in 2004. I hope you voted for it. That was Prop 71. It created a still unique, definitely unprecedented, and still unique state agency nationwide in California with $3 billion in initial funding to fund stem cell and related research around California to try and address both the fact that this was a new area of science that had promise and shouldn't be shut down, and also the fact that there are so many people suffering with chronic illnesses and diseases in California, in this country, and around the world. And we don't want to be responsible for having world-class institutions and not being able to do this research. So we got Prop 71 passed in 2004. I was part of that. And the money was about to sunset in 2020. So we went back to the ballot and got another $5.5 billion, which is a bigger price tag. And for those of you that know about medical research, while those numbers are not small, they're big, they're not that big, because it costs probably still $1 billion to get a drug all the way through the process from discovery in a laboratory, through translational medicine, usually animal models, then into clinical trials, and all the way through the IND process with the FDA. So if you use that math, it's a little easier than lunch math, but still fairly complicated. That would get you about 5 drugs, if you think about it. But that's not what our hopes are for this agency. Our hopes are that it will be lots of discoveries, so we fund basic science, that will lead to many projects that potentially could lead to dozens of better treatments, and like I said before, hopefully eventually cures for some of the chronic illnesses and diseases that we've been suffering with for so long. So, just a few facts about the agency, again created in 2004 by you, the voters. As a patient advocate, that's a very important way for me to think about these initiatives in this agency. They are ours as citizens in California, as the voting public in California. And by most measures, although I can't yet tell you, CIRM has come up with its funding of research, a cure, because there are some...
Can't hear back here.
You can't hear? Oh, okay.
Just hold your breath.
Okay, thank you. Hold it just like that? Okay. So, well, I can't tell you that CIRM has come up yet with a cure for a particular disease or illness or injury that they have set out to fund research toward. I can tell you that we're getting very close. Because by the time I came back, having worked on Prop 71 in 2004, I then also hired the first 10 people at CIRM, and we built the agency over the first 6.5 years. We were sued, it was called unconstitutional, even though it was a constitutional amendment. And I was there for 6.5 years and then I left, never having dreamt of being a state employee, really, but I do like to build things. So I left, and when I came back in 2018 to lay the groundwork for what became Prop 14 in 2020, that we just got passed 2 years ago to get that additional $5.5 billion, CIRM, by most measures, had been very successful. They had awarded almost the full $3 billion that they were allotted in the first place in grants, and by design, in Prop 71, something that I like a lot also, this would never be a large bureaucratic state agency. The number of employees was capped, thank you, the number of employees was capped, and the amount spent on overhead was capped as well, which meant that most of the money went to research, and here are some of the results. 1,100 plus research programs funded. From basic science in a lab looking into a microscope, through translational medicine, and all the way to clinical trials. 86 clinical trials have been funded by CIRM, and that number isn't actually the total when you think about the number of earlier phase research funded by CIRM that have led to clinical trials that are funded by other people. And 3,200 patients enrolled. I'd like to see that number go up. And in Prop 14 in 2020, we wrote right into the initiative that access and affordability, not just for any resulting treatment or drug, should be part of the program, but also for people to participate in the trials. Because a lot of the time, participating in a clinical trial can be costly if it's not happening anywhere near where you live. $23 billion in CIRM-funded projects raised through other elements of support. Okay, so just to show you a little bit about what these accomplishments by CIRM mean. 3,100 peer-reviewed publications. We built 12 buildings, and Mark is back, so now I'll talk about the Buck in Novato. One of the buildings that CIRM built is actually at the Buck. There's another one at UC Davis. Berkeley gets a lot of our funding as well, Chris. And I don't want to read slides to you, but I don't know if the people in the back can see them.
Read them.
Read them, okay. So we've enabled the invention of research and translational tools, built the largest iPSC research bank with more than 2,600 cell lines for modeling. I'll go into a little bit of detail about what iPSC means. That is induced pluripotent stem cells. And what you may recall is that since CIRM was founded in 2004 by way of Prop 71, a new process for getting pluripotent stem cells, which are the ones that you need to be able to study any system in the body, because they don't yet know what they want to be when they grow up. They're pluripotent. They can be anything. They don't know yet that they're going to be your eye or your kidney or part of your blood system. And it used to be that the only way to get these was from a very, very early stage embryo. And without going too much into a political conversation, you can imagine that that was difficult in a lot of places. And so now we have what are called induced pluripotent stem cells, and the way we get those is we induce a cell. So I would come over here and I would take one of Frank's skin cells. Thank you, Frank. I'm just going to take one of your cells. I've got his cell now, and what I'm going to do is throw 4 genes on them. Thank you. Thank you for being a donor. And with that induced pluripotent stem cell, I can create more of them, and I can use those to study a particular disease and potentially derive types of cells that are needed, maybe a neuron to try and cure something like MS. And so we've built the largest bank in the world for those types of cells with the CIRM funding. Okay, what else have we done? We have 9 alpha stem cell clinics. Yes, and we have expedited pathway designations from the FDA for some of the programs that have come through with CIRM funding, which is really, that means that it's good science and it's going in the right direction. We're heading toward better treatments and cures. Progression of 86 programs to therapy development, and a lot of this is similar to the data you saw before. That's the clinical trials. And thank you for that, because this is a big one. We have accelerated 73% of funded IND-enabling programs to initiate clinical trials within 2 years. And the reason that that's important is that CIRM, your state stem cell and related research funding agency that you make possible every day, has brought these projects to clinical trials much more rapidly than people have expected, and we have to do those trials if they're ever going to be treatments or cures for these diseases that we'd like to find answers for. What else have we done? This may interest you as well. We've trained 3,000 students and scholars to become the future workforce for regenerative medicine. So we need people at Berkeley, we need people at the Buck Institute, but we also need people working at Amgen, working at Gilead, because it takes industry to bring these types of treatments out all the way through the pipeline and to the public. So, what have we done with the $3.6 billion in grants to date? Again, I'm going to read from the back of the room because I know the print is small. $1.1 billion has been spent on discovery. Discovery is earlier stage research. Again, what's done in a lab, not with an animal model and not in a human. And then we have to spend money on translation. We've spent $503 million on that. $1.1 billion on clinical work, and more, near and dear to my heart, $489 million for education and infrastructure, because without those two things, we can fund some great science today, but then what happens 10, 15, 20 years from now if there's nobody that's been trained to do this research? And that takes money too, and what if they don't have the lab to do it? Okay, so clinical trial portfolio. And I'm wondering if in this group you're interested in anything that you see on the screen. I'll name what we funded. 19% has gone to blood issues with the blood system. 7% to the kidney. HIV/AIDS 5%, dysphagia 1%. COVID-19, CIRM was very nimble in 2020, turned on a dime, got an RFA out, and actually funded some research that led to some successful elements of what became useful to us for COVID-19. And also a story I like to tell about CIRM is that a postdoc at Stanford, way back in 2005, when we first got our early grants out, was one of the founders of Moderna. So he was a professor at Harvard at the time that Moderna was founded, but he came out of a lab at Stanford that was funded by CIRM. We've got 4% on musculoskeletal, 5% on heart, 7% on eye, 5% on diabetes, 9 on solid tumors, and then what I haven't said yet is 20% on neuro. I wish that number were bigger, although I wouldn't want to take it out of anywhere else. But another thing that we did in Prop 14, which was passed in 2020, is we carved out of the 5.5 billion, 1.5 specifically to neuro and neurodegenerative diseases and issues of the central nervous system. These are really difficult diseases to learn about and to try and treat. And while CIRM has allotted a good amount of its funds to them, there needed to be more, and I'm happy to tell you that more is going to those. So, Prop 14 era, that's today. This is a little bit about what CIRM is doing with the funds. We've already gone over a lot of this, so I'm not going to read it, just going to move right on. This is what I really wanted to get to. We talked a little bit earlier about where the funds are going, and they go, much of them, to the UC system and places like Stanford and USC, the Buck Institute, and there are several institutes like that, the Salk and the Scripps down in the San Diego, La Jolla area. But local to you, UC Davis Health, UCSF, the Buck Institute, Berkeley, and Stanford, I would say, are the places, if you were interested in where funding was going from the agency and where some of the great work of the scientists around California is happening near you, those are the places near you where that's happening. And as a member of the public, if you ever wanted to visit one of the stem cell buildings that CIRM has provided funding for, there's a director of the Stem Cell Center at UC Davis, for example, that would be happy to provide you with a tour, everything that you can go see. This is something I think we forget sometimes as citizens, we can go do that. And they're very interested in talking with patients and patient advocates and just people that are interested in the research and where it might lead us. So we've really already talked a lot about this as well, so I'll move on. All right, a little bit of detail on the education programs, and this is something for, I know some of you are doctors or scientists, or you were working in those fields, or maybe you have a significant other, somebody in your family that is. CIRM offers conference grants. So for an event just like this, potentially, as long as it was pertinent, you could potentially get a conference grant. And I've actually helped a nonprofit focused on Parkinson's disease get one for a series of continuing medical education webinars that they're giving. And I wanted to mention that to this group because if you know anybody that is working in that area and this might be pertinent for you, might want to go to CIRM's website and just check it out. The rest of the education programs really, they go all the way down to high school, which I think is excellent, trying to inspire young people to go into this field of biomedical research and even maybe specifically stem cells, and certainly for undergraduates, and we fund people in their own labs as well. So just some numbers, because I bet some of you have kids and grandkids, I'm just guessing. 530 high school kids in California have been trained, 1,600 undergraduates, and then 940 pre- and postdoctoral and MDs have been trained by using, again, funds from this state agency that you made possible. That you made possible by voting for it and that you make possible every day. So it's not all going to the ivory tower, although I like the ivory tower. All right, and so this is a little bit of detail about a new education program, Compass, that is for undergrads, and I just put a little bit in here because it's brand new. The board just approved it. We want to prepare undergraduate students to be thinking about regenerative medicine even before they decide, am I going to get an MD, a PhD, am I going to be a lawyer? It's better for us when society knows about science and knows the details about a specific area of science going, and that pulls through everything. It pulls through policy, we're all voters, it pulls through for funding, and it pulls through just so you know what's available to you and your family members as potential treatments and cures or clinical trials to be part of. So, and foster greater awareness and appreciation, yes, we've already talked about that. So that is what I have in the way of a slide deck. I don't know how much time we have left, but what I'd be happy to do, if of interest to the group, is just answer any questions you might have. I tried not to make it too long of a boring talk. I could have gone into great detail about grants, but yes.
So does this research involve gene editing? Does research involve gene editing?
Just want to make sure.
Like CRISPR and that sort of thing?
Absolutely.
Second part of that is, when you get to your end game and you develop a drug or whatever, is this something that you can patent?
Great question. Excellent questions. Okay. So, can you hear me?
Repeat the question.
Yes, I will. So the first part of the question was, does the research that CIRM funds now include gene editing and technologies like CRISPR? And the second part of the question is about patenting and whether or not CIRM can patent the technology that is developed using its funding. So I'm going to answer the first part first. Absolutely yes. Programs that include gene editing, absolutely, and using CRISPR and other tools for gene editing. And I can also tell you Jennifer Doudna, who is at UC Berkeley, who just recently got a Nobel Prize for CRISPR, is in the CIRM network, I would say. Some of her work is funded by this agency. And the other thing I can tell you is there's a gentleman, a specific program that I can name and hopefully put a face to the use of gene editing and how important it can be. There's a gentleman at UCLA, Dr. Don Cohn, and he's an MD, and he's doing clinical research, and he's trying to cure two things. He's trying to cure severe combined immune deficiency, which is SCID, baby bubble disease. You remember that movie with John Travolta, The Boy in the Bubble? That's this disease. Babies are born with no immune system. So what can you do for a baby born with no immune system? One thing that you could do is you could give them a transplant of what are adult stem cells, your bone marrow. Even in a baby, the bone marrow of a baby, that's actually adult stem cells because they've already decided what they want to be when they grow up, even though the baby's still a baby. You can give them a bone marrow transplant and hope that with that marrow from a different person, maybe a sibling, will cure them of the disease, but then you also have all of the other problems that come along with getting a bone marrow transplant from somebody else, all of the immune issues that you have. And not only that, even when someone is a genetic match for you, it may not help you. It may not help you develop the immune system that you need to really stay alive more than a few years when you're born with SCID. But what Dr. Cohn now does is he takes the bone marrow out of the baby, out of their little tiny hip, takes the bone marrow out, edits the gene that causes SCID, and puts the same bone marrow back into the baby, so it's autologous. It's their own cells, and the gene is fixed. And these babies develop an immune system. And I know a little girl who's 8 years old that was cured by this. Her mother was one of our great ambassadors for the Prop 14 campaign, and there are 60 children that have been cured by Don Cohn, but again, can't call it a cure yet, because they have to do phase 2 and 3 clinical trials and go through the FDA process before this will be called a treatment, a cure, approved by the FDA. But we're getting there, and we're getting there with other projects as well. Now, with respect to patents, I'm not a lawyer, I'm not an IP expert, but I was at CIRM when the board, in the first couple of years, developed the IP policy, and there were people from industry, and there were doctors and people that work in technology transfer out of our fine universities, and CIRM came up with an IP policy that nobody can love, but everybody likes. And what that means is CIRM doesn't get the patents. The patents go to the institution where the money goes, whether it is an institution or actually CIRM can give grants to industry as well. They've had a loan program in the past. And so wherever the funding goes, that's where the patent goes. But there are elements of the IP policy that make it such that money comes back to CIRM, which is good because it's one way to greenfield something, right? Or to evergreen something. Money comes back to CIRM, and actually a slice of it goes to the state if IP leads to great profit. Now, at this point, there actually has been great profit that has come back to CIRM into one institution, and then there are smaller pieces that have gone elsewhere, but I'll tell you about one really big one. A gentleman at Stanford, Irv Weissman, another MD like Don Cohn, he's been doing cancer research for probably 50 years. He's quite an amazing guy. And when CIRM first opened its doors 20-ish years ago now, Irv had a project that he had worked on at Stanford and had partnered with pharma. And I won't name the pharma company, I don't need to badmouth anybody, but they shelved it. And I don't remember exactly why they shelved it, but often, to be fair, industry will shelve something because something happens in a trial that looks like it might be because of the treatment, the substance, whatever it is, the drug. But anyway, the research gets shelved and the company then owns the IP. Instead of Irv and instead of Stanford, the company owned the IP, and he couldn't get it back for quite a while. Well, he got it back. I don't know exactly how that works. Like I said, I'm not a lawyer. I don't work in tech transfer. I admire the work that they do. It gets dicey. Excuse me. But Irv got his technology back. He got a CIRM grant to continue his work, created a company called 47, and thankfully for me, when I was trying to run field operations for a political campaign in 2020, he sold that company. First of all, he's curing people of cancer with his technology, but he sold that company to Gilead for $4.9 billion. Yeah, exactly. More, almost as much as we got total in Prop 14, in 2020, that will be spread out over the next 20 years. He sold it for $4.9 billion. Now, Stanford got a piece of that. CIRM got a piece of that. Excellent, right? And if we could get a few more of those, it really may be an evergreen program. Thank you very much for the great questions. Any other? Yes, sir.
I understand right now that stem cell treatment is illegal in the United States, correct? And what is your best guess estimate? Are we 5 years, 10 years, 20 years down the road for one of these drugs? And
great question.
what other countries is it legal in?
Sure. So the first question is stem cell treatment illegal in this country? And then how far are we from having, if I understand you correctly, one of these treatments or drugs, sometimes small molecule drugs are developed based on a stem cell research program as well. It doesn't have to be a cellular treatment, which are actually still pretty new on the scene. Having cells put into you, that's a relatively new concept still. Taking a pill, not so new, right? So, wonderful question about whether or not it's illegal. So what CIRM supports are evidence-based research programs. And by evidence-based, I know you all know what I mean, but I think it's important to say it, to name it, when you're talking about medical science. Evidence-based means it's being done in a lab that is on track to go through a process with the FDA before anything is called a treatment or drug that can be used by a human being to try and treat an illness or a disease. And at that point, when it's gone through that process, you know that some pretty heavy-hitting experts at the FDA, whether we like them or not, I go in and out of liking them because sometimes they accelerate things, sometimes they don't. It's a big bureaucracy. There are some good people there. There's a good person running the cellular treatment, Peter Marks, that area. Thank goodness for all of us right now. But so evidence-based has to be on that path. And what's not on that path is a clinic that tells you that you can go to them and they'll take some of your fat cells, I've got a lot of them, spin them around, and then use them to inject into your body somehow and cure you of a disease. I can tell you right now, that's not true, because there's a list of cellular treatments that have been approved by the FDA on the FDA's website. I looked at it recently, it's like 20. There are 20, right? So, unfortunately, as much as sometimes this makes me laugh, I'm like, oh yeah, you're gonna spin my fat and you're gonna cure me of whatever it is that I have, right? Well, it's not funny, because unfortunately, we all have hope when we have a disease, and I'm a cancer survivor, by the way, so I can actually say this as a patient. I am a breast cancer survivor. We have hope when we or someone in our family or our friend and loved ones network is suffering with an illness, and we hope that when someone tells us that they can cure it, that they're right. And the problem is that then people not only are given hope about something that they shouldn't, but they spend money, a lot of money sometimes, to get treatments at a clinic. Either in this country, they cropped up in the last several years, or a lot of people tell you, oh, I went to Panama and got stem cells. And it's just, the evidence isn't there. I'm not going to tell you it's not true. I've talked to some people that say, I got stem cells in my knee and I'm much better. You know what, maybe that's true, because maybe the stem cells went into the knee and they actually regenerated some of the cartilage. There are people working on projects like that. But there are also people who have had their own fat cells spun around and injected into their eye to try and cure them of AMD, macular degeneration, and they died. Just so you know, they passed away. I have a question here and one back there. I'm going to go up front first.
Mine's a real quick question. It's my understanding, does the FDA, the Food and Drug Administration, has a problem with practitioners using the term stem cells?
I'm going to answer that. It's in the same vein as the prior question, so I never really said whether or not it's legal. So here, and we're getting to it now with your question. Thank you for that. So this is a seminar, not just a talk. So the FDA is in a position right now where it's having to crack down on the clinics that I was describing. The clinics that will tell you you can go to them, and with stem cells, usually from your own body, autologous, much safer than getting something that you don't know what it is, right? Like buying drugs on the street and not knowing it's half fentanyl. What is this bag of cells you say you're putting in me? At least if it's your cells, maybe that, that's a little safer, but don't let them put it in your eye, that's for sure. But the FDA is having to crack down on these, and it's not that they don't want a CIRM-funded researcher to use stem cells. If you go to the Buck Institute, or you go to Berkeley, or you go to Stanford, UC Davis, lots of people are talking about stem cells. And again, bone marrow is adult stem cells, and we've been doing treatments with bone marrow for leukemia and other diseases for 75 years at this point, I think. What the FDA doesn't want is a business to say that it is doing the business of stem cell treatments, because they're not FDA approved. And they could be dangerous, and at the very least, they're not efficacious. They're not going to cure someone of Parkinson's disease. I can guarantee you that. I did have one more question in the back, but I'm also sensing I need to stop, okay? Sure.
Thank you so much, Melissa. With your permission,